Everybody, I'm Dr. Ed Park. I'd like to explain to you, if you're interested in exosomes and incorporating them into your clinical practice, how my online training course can help you. So I'm going to go through not all of it, but there are 20 weeks that I took to create this. And so we'll review some of the highlights and explain to you how this can help. This is from the first lecture where I describe how I found out about exosomes, how I experimented myself, then my mom, and a little bit about my background. We go over in this lecture some of the most extraordinary cases. This man, again, not photoshopped, had irritable bowel syndrome from a leaky gut and mast cell activation, and he remains cured after one shot. A couple of patients with nerve pain, Bell's palsy, we review, as well as this extraordinary case of alopecia reversal after exosome use. In the second lecture, we address the question, will you get in trouble? We talk about medical malpractice. We talk about medical boards. We talk about my consent, which is downloadable to all participants of the course, and you can customize it. We talk about competitors, and we talk about the Food and Drug Administration. What's legal, what's not, how are we even doing this? In the third lecture, we talk about brands, and this has to involve discussion of how they isolate exosomes. So you'll have a working knowledge of how they isolate exosomes and then how to decide whether they're good. Is it particle number? A lot of the reps say more billions for less money is better. But on these machines, as you can see here, the NanoSite, you can just turn up the gain and go from billions to trillions to quadrillions. So buyer beware. We'll also talk about labeling of the exosomes, so you know you'll have these canonical MSC exosomes. And most importantly, the RNA content. The potency is measured by the amount of RNA inside these tiny spheres. Then we go into a very important aspect in week 4 about how much you should charge. Your ethics will determine your margins, but we do talk about a 1 to 1.5 multiplier perhaps, and there are different prices. It's hard to compare different brands. Of course, the value equation is how much will you need? So sometimes people are one and done, like the guy with the leaky gut was one and done. My knee on the right 4 years ago, one and done. I just spoke to a trainer who I did her knee. It was terribly arthritic, bone on bone. She's been fine for 2 years. But sometimes they're like brake pads, and you don't go from a worn out brake pad to a perfect one. Sometimes you need multiple treatments. We also talk about screening patients, red flags, if you will, personality types that have caused more trouble than they're worth. And you can also develop a sort of sixth sense regarding that. In lecture 5, we go over the patient-physician relationship and how you should treat patients, both from a technical standpoint and from an overall management standpoint. We'll go over the sterile techniques, exactly what you will need. We go through certain pearls and injecting, how to avoid problems, complications, and uncomfortable experiences. And then we talk about how to maintain repeat customers. Most of my patients are repeat customers. You fix one thing and they want you to fix something else. In the 7th week, we discuss using the Stephen Covey course method, how to ensure patient satisfaction. And he has these 7 aphorisms that he uses. One of them is put first things first. And so we talk about a very important aspect, the informed consent. We also talk about thinking win-win, which is important, and how to maintain that good relationship. In the 8th lecture, we discuss ultrasounds, which ones to buy, which ones to avoid, how to use them, and which procedures best require an ultrasound. We discuss the in-plane technique, how to do it, and we talk about the hip injection, which is a particularly useful way to use the ultrasound. In week 9, we go over everyone's bread and butter, which is the musculoskeletal system, tendons, ligaments, etc. And we talk about a little bit on a biochemical level, how those are made, how those are repaired, and that will get into a little bit of a discussion of inflammation, proliferation, repair of stem cells, and remodeling. And one important pearl I always tell people is that a lot of times the people will feel good in the first few weeks and start exercising vigorously. But of course, the collagen in the first 10 weeks is collagen type 1, which is not as strong. in these structures, so they can get re-injured. So you really have to warn people, even if you're feeling good, you need to be cautious. We talk about the Achilles tendon, which I've had to treat twice, the shoulder, which I've had to treat twice more in the last 4 years. But all in all, a pretty good bargain, knowing that I have something to improve function and decrease pain. Golf or tennis elbow, another one you'll find yourself doing a lot of. In all of these lectures, this is week 10, we're halfway through now, we talk a lot about anatomy, which for many of you is a review. For many of you, you don't need it. Others, you might learn something new. We discuss the meniscal tears, how to clinically examine for those, the knee sprains of the lateral and medial collateral ligaments, and the anterior posterior cruciates. We talk about different pearls for the leg injection, which is really a very simple injection, ultrasound not needed. And probably if you're going to the suprapatellar bursa, that's an inferior technique, as we explained. In lecture 11, we go into the shoulders, the different muscles, how to clinically examine them and how to inject them. Pretty easy procedure and very, very safe. Rotator cuff injury, this is the one I got from yoga, subscapularis. Again, amenable to treatment near the insertion. Oftentimes we'll do it in the subacromial bursa as well. Although arguably that's more for the supraspinatus, but all the rotator cuff tendons do kind of pass along in that area. Here's the actual technique illustrated. And you can see that because the scapula is where it is, you are nowhere near the lungs to cause pneumothorax. We go over different needles, why the front of the neck is very dangerous to inject. And this is from the lecture on the hips. In the hips, we talk about the rotators, the flexors, extenders. Everything is a great review of the anatomy, and you will learn quite a bit, I think. We talk about the hips as anatomy, as a region, as a function. There you have labral tears, things like that. Here's the commonly inflamed IT band at the trochanteric bursa, common technique. And also these more esoteric symptoms of piriformis, which can cause sciatica. We talk about how complicated the hips are and certain techniques used to treat them. Here's an example of a common problem in modern life is weak abdominals and glutes causing pelvic tilt and sway back and problems with low back pain. As we progress to week 13, we discuss nasal injections, which is a technique that I've been using quite effectively, I think, for many different conditions. It does access the central nervous system. We talk about nerves, what they are, how they naturally heal. And we talk about the glymphatic system, which people may not know about, is how your brain clears out at night and the function of sleep. We talk about short circuits that have been ameliorated with exosome injections and how they're probably working. And we talk about how to deliver into the nervous system, whether it be around the sheath of the nerve itself, which is easily found by ultrasound. IV, intrathecal, and nasal are also available to us. Finally, we go into some of the aesthetics, which you'll see Kim Kardashian with her vampire facial. The use of PRP is very inflammatory and you get very red, but the use of exosomes is very anti-inflammatory and there's almost no downtime. So I think it's a superior technique. We go into that. As we close out, this is a list of everything I use when I travel to 5 different states. And that's really all you need to have a clinical exosome practice, other than good judgment, good listening skills, and constant learning. So I want to offer you this course. It's at $1,700. It's over 12 hours of instruction with, gosh, it's got to be over 160 questions. None of them trick questions, all meant to reinforce the learning objectives. If you pass the final exam with 70%, 42 out of 60 questions, multiple attempts are okay. You will get the certificate to print. And the $1,700 course tuition is credited towards purchase of Chimera brand exosomes. The course never expires. Your access to updated forms that you can download and customize never expires. and your credit towards buying Chimera brand exosomes through me as a distributor never expires. You will have permanent access to these forms, to these consents, and you can also call me for personal advice on how to grow your practice. We recently had a few doctors that we met in Las Vegas A4M who signed up and got free freezers, over $2,000 freezer sent to them for -80 storage, which might be a little better. So you just have to buy 10,000 worth, I think, and the company will send you a free freezer. So I'm sorry we rushed through that, but I think that gives you a kind of the gist of what we're talking about. I think most importantly, doctors want to sound smart, and we have a pretty good explanation of the science insofar as we can understand it, and that'll help you be a little more comfortable discussing patients when they ask you, well, how does this work? Is it safe? Where does it come from? So in the course of these 20 weeks, we created something that's quite user-friendly. It's for an advanced clinician practice, but still explained with analogies and simple terms that everyone should be able to understand. So again, I invite you, if you want to help people who really can't be helped by a lot of the modern technology. We're talking about diseases of aging, of tendinosis, arthrosis, of wearing out. Then I think the clinical use of exosomes from mesenchymal stem cells is a powerful tool. And I think I've seen amazing results that really can't be replicated with anything else other than perhaps stem cells and PRP. But again, those are somewhat, as we discuss, difficult to implement in terms of cost, procedure, risk, and efficacy as well. So all in all, in the last 4 years, been very happy with about a 70% response rate, only one serious complication from a knee infection, and pretty predictable dosing, pricing, and I think it's a great opportunity to get more financial freedom and to really help people in ways that they otherwise couldn't be helped. So again, Dr. Ed Park, feel free to contact me if you have any questions, and invite you to join the course, which is online and self-directed, and hopefully a good foundation for establishing a practice. Thanks for your time.